दिल्ली के यहाँ पर उपस्थित हैं, ये सारे लोगों को मिलजुल कर अपने सारे पुराने वास्तु अनुभवों का इस्तेमाल करके और फिर साथ में जो एडमिनिस्ट्रेशन है, पुलिस है, सिक्योरिटी के इश्यूज हैं, वो वैक्सीन की जब ट्रांसपोर्टेशन होगी या फिर वैक्सीन जो है वो जब साइट पे डिलीवर होगी, वहाँ पर जो हमारी प्रपोज्ड लिस्ट है जिनको हमें वैक्सीनेशन देना है, ये जो पोटेंशियल बेनिफिशरीज हैं, उनके साथ कम्युनिकेशन ठीक से हुआ कि नहीं हुआ, उनको टेक्स्ट मैसेजेस जा रहे हैं कि नहीं जा रहे हैं, उनको वैक्सीनेशन मिलने के बाद इलेक्ट्रॉनिक उनको सर्टिफिकेट देना है, वो सब चीज़ें करके हमें देखना है। और हमारा जो प्लेटफॉर्म पर हमारा जो अपलोडिंग का काम है, हमारे जो डाटाज हैं या फिर जो हमारे पास अपलोडेड जो लोगों की लिस्ट है, उसका डिवीजन का काम है कि किस बूथ के ऊपर, किस अस्पताल के अंदर, किस स्थान पर किसको किस दिन किस समय वैक्सीनेशन मिलेगा। क्योंकि जो कोविड प्लेटफॉर्म है वो उस ऐप के ऊपर और हमारा जो वैक्सीन का जो इंटेलिजेंस नेटवर्क है उस पर बेसिकली जहाँ एक तरफ वैक्सीन के को उसकी लोकेशन और उसका जो टेम्परेचर और उसकी सारे इश्यूज को ट्रैक किया जाता है, उसके साथ साथ पोटेंशियल बेनिफिशरी को भी उसमें ट्रैक किया जाता है और साथ में वो पोटेंशियल बेनिफिशरी को किस दिन, कहाँ, किस समय और किसके माध्यम से ये वैक्सीनेशन मिला, ये सारे इश्यूज हैं। तो अभी तक आप लोगों को इतना ज़रूर समझ में आया होगा कि इसमें बहुत मैसिव एक्सरसाइज विद द माइन्यूटेस्ट पॉसिबल डिटेल्स and it has been framed in consultation with relevant stakeholders। फिर साथ में जो NGOs का इन्वॉल्वमेंट है, NGOs के साथ भी बहुत सारी मीटिंगें यहाँ सेंट्रल लेवल पे भी हो रही हैं, आप लोग भी कर रहे हैं। उनका जो स्टेट की जो टास्क फोर्स है या जो एक्टिविटी करने के लिए जो हमारे ग्रुप्स स्पीयरहेड कर रहे हैं इस कैंपेन को, उसके अंदर उनका एक पर्याप्त लेवल पर इन्वॉल्वमेंट इत्यादि। तो ये बहुत सारे विषय हैं जिनको हम लोग चाहते थे कि ये सब चीज़ों को समय से पहले भी सब लोग खुद अपनी सेल्फ ऑडिटिंग ऑफ देयर ओन प्रिपरेशंस करें। और यहाँ पर हम लोग अपना सारे देश के साथ कोऑर्डिनेट कर रहे हैं। तो आज मैं अभी चाहता था कि हमें दिल्ली के जो हेल्थ सेक्रेटरी हैं और खासकर 3 डिस्ट्रिक्ट्स के अंदर जो हमारे ऑफिशियल्स हैं या जो मेडिकल ऑफिसर, इम्यूनाइजेशन इत्यादि इंचार्ज हैं, कुछ थोड़ा सा आप अपनी तैयारियों के बारे में बताएं। और जो कल आप मॉक ड्रिल करने वाले हैं, मेरा प्रयास होगा कि किसी न किसी मॉक ड्रिल में अगर संभव होगा तो हम लोग हो सकता है कि आपके साथ उपस्थित भी रहें फिजिकली देखने की दृष्टि से। तो मैं चाहता हूं कि सबसे पहले तो ये काम तो पहले ही मुझे करना चाहिए था, लेकिन आप लोग भी सोचते होंगे कि ये नव वर्ष में भी आज भी जो है हम लोगों ने आपको कोई थोड़ा सा रिलैक्स करने का मौका नहीं दिया है। लेकिन अभी आप जानते हैं कि जब पूरे 2020 में आप लोग रिलैक्स नहीं हो पाए और उस सब के कारण ही सारे देश को ये परिणाम मिला सुखद कि हम बाकी दुनिया से बेहतर ढंग से जो है कोविड को हैंडल कर पाए। आज 99 लाख के करीब जो है लोग ठीक होके, लगभग 99 लाख लोग ठीक होके घर चले गए हैं। और हमारा दुनिया में सबसे ज़्यादा रिकवरी रेट है, सबसे कम फैटालिटी रेट है। और दिन प्रतिदिन हम देख रहे हैं कि कोविड के केसेस की संख्या में कमी आ रही है। वैक्सीन फ्रंट से भी अच्छी खबरें आने की संभावनाएं हमें नज़र आ रही हैं। तो इन सब के कारण लगता है कि 2021 का वर्ष हम सब के लिए 2020 से निश्चित रूप से बेहतर होगा। 2020 ने सबको एक आत्मिक बल दिया है, सबको मिलजुल कर लड़ने की जो योग्यता, क्षमता कोऑर्डिनेटेड एफर्ट से सारा देश मिलके कैसे बड़े से बड़ा काम भी जो है सफलतापूर्वक कर सकता है, ये हमने देखा है। हेल्थ से लेकर साइंस तक और साइंस से लेकर सोसाइटी तक सब लोग, और पूरे के पूरे सरकार के अंदर भी पूरे ऑफिशियल्स, सब लोगों ने मिलकर हमारे प्रधानमंत्री नरेंद्र मोदी जी के नेतृत्व में बहुत अच्छा 2020 में काम किया है। उस सबके लिए भी आप लोग बधाई के पात्र हैं। और विशेष रूप से जो कोरोना वॉरियर्स हैं, डॉक्टर्स हैं, हमारे फ्रंट लाइन पे जिन्होंने काम किया है, जो अस्पताल में दूसरा नर्सिंग स्टाफ और दूसरे लोग हैं और दूसरे फ्रंट लाइन वर्कर्स हैं, उनको भी हम लोग हृदय से आज अभिनंदन भी करना चाहते हैं, बधाई भी देना चाहते हैं। उन्होंने अपने प्राणों को खतरे में डालकर और हम लोगों के प्राणों की रक्षा की है। बहुत सारे हमारे साथी इसमें शहीद भी हो गए, चले भी गए, लेकिन उसके बावजूद भी 1 साल के बाद भी जो आप सब लोग हैं देश में, वो थके नहीं। और 2021 का प्रारंभ होने पे भी जैसा कि हम देख रहे हैं कि सब लोग काम के ऊपर आकर जुट गए हैं। ये अपने आप में हमारे सभी, खासकर स्वास्थ्य से जुड़े हुए जितने भी देश भर में लोग हैं, अधिकारी हैं, सब हैं, डॉक्टर्स, इनको मैं हृदय से आपको सबको बधाई देता हूँ। दुर्भाग्य से ज़रूर देश में हम लोगों ने कई सारे लोगों के प्राण जो है चले गए हैं। भले ही 1.45% हमारी फैटालिटी रेट है, लेकिन जिसके घर में कोई परिवारजन गया है उसके लिए तो ये 100% जैसा ही होता है, एक व्यक्ति भी अगर किसी परिवार का हुआ है। तो अब हमें प्रयास करना है कि किसी भी प्रकार की कमी ना छोड़कर, जो खासकर आज हम जिस विषय पर चर्चा करने के लिए एकत्रित हुए हैं कि वैक्सीनेशन का काम स्मूथली, थॉरोली, कॉम्प्रिहेंसिवली, अच्छी तरीके से, बिना किसी प्रकार की उलझनों के, रुकावटों के, बॉटलनेक्स के हम ठीक से संपन्न करा पाएँ। और मैं आपको विश्वास दिलाता हूं कि जितनी डिटेल में हमारे साथियों ने सारी गाइडलाइंस पर काम किया है, उसको अगर गहराई से समझकर और उसकी ट्रेनिंग और उससे जुड़ी हुई जानकारियां नीचे तक अगर हमने ठीक से सबसे शेयर की और उसके साथ साथ उसके मॉनिटरिंग मैकेनिज्म भी अपनी अपनी व्यवस्थाओं में ठीक से खड़े किए, तो मुझे पूरा विश्वास है कि अगले कुछ महीनों में हमारा ये वैक्सीनेशन का प्रकल्प जो है ये भी बहुत स्मूथली निकल जाएगा और कोविड के खिलाफ जंग की जो एक ये प्रकार से अंतिम जो चरण है, इसमें भी हम लोगों को भारी सफलता मिलेगी। इन्हीं शब्दों के साथ मैं आप सबको नववर्ष की शुभकामनाएं देता हूं। आप सब स्वस्थ रहें, प्रसन्न रहें और आपके जीवन में और बेहतर खुशियां आएं और आपके माध्यम से और ज़्यादा सक्षम तरीके से देश और समाज के लोगों की हम स्वास्थ्य की रक्षा कर पाएँ 2021 में। इस उम्मीद के साथ मैं कुछ थोड़ा सुनना चाहता हूँ दिल्ली के अपने साथियों से कि उनकी क्या तैयारी है, और फिर हम में से किसी के भी मन में कोई प्रश्न होंगे तो वो ज़रूर आपसे हम शेयर करेंगे। तो सबसे पहले हेल्थ सेक्रेटरी जो हैं दिल्ली के अमित जी, उनसे हम सुनना चाहते हैं कि क्या उनके मन में तैयारी है, और खाली कल के ड्राई रन के बारे में नहीं, एक ओवरऑल पर्सपेक्टिव में ड्राई रन तो भले ही 3 जगह पर हो रहा है, एक प्राइवेट अस्पताल में हो रहा है, एक दरियागंज में हो रहा है, एक पूर्वी दिल्ली के जो बड़े प्रतिष्ठित अस्पताल जीटीबी में हो रहा है, लेकिन ओवरऑल भी हमें बताएं और अभी कल के जो ट्रायल रन है उसके बारे में भी थोड़ा सा जानकारी दें। अमित जी।
सर नमस्कार सर, मैं स्टार्ट करूंगा सबको सर नववर्ष की शुभकामनाओं के साथ सर जो आपने कहा 2 भाग में कि ओवरऑल प्रिपेयर्डनेस के बारे में बताएं और फिर उसके बाद ड्राई रन के बारे में बताएं। मैं दोनों पक्षों को टच करता हूं सर। सबसे पहले सर ओवरऑल प्रिपेयर्डनेस। तो ओवरऑल प्रिपेयर्डनेस के हम जो भारत सरकार से ऑपरेशनल गाइडलाइंस आई हैं सर, उनके बिल्कुल उसके मुताबिक तैयारी की जा रही है सर। समय समय पे मीटिंग्स हुई है और हमें जो जो भी कहा गया है, जो टाइमलाइंस दी गई थी सर, वो उसके मुताबिक किया जा रहा है। तो 5-6 बिंदु उसमें थे सर, जो जिसके ऊपर हमें फोकस करने को कहा गया था। एक तो सर कुछ टाइमलाइंस थी, 10-12 एक्टिविटीज की सर। तो सारी टाइमलाइन, सारी एक्टिविटीज हमने टाइमलाइन में पूरी की है सर। फिर हमें कहा गया था कि जो मल्टी लेवल जो कोऑर्डिनेशन मैकेनिज्म है, जो स्टेट लेवल पे स्टीयरिंग कमेटी है, फिर टास्क फोर्स है, फिर सर डिस्ट्रिक्ट लेवल पे टास्क फोर्स है, फिर सब डिविजनल लेवल पे टास्क फोर्स है, उन सबको गठित कर लिया गया सर। उनकी मीटिंग्स जो है प्रॉपरली हुई है सर। एक 2-2, 3-3 मीटिंग तकरीबन सब लेवल की हुई है सर। फिर नेक्स्ट स्टेप था सर कि हेल्थ केयर वर्कर्स का डेटा इकट्ठा करना था और उसको कोविन सॉफ्टवेयर में सब में उसको पोर्ट करना था सर। तो वो जो दिल्ली सरकार की, जो दिल्ली और लोकल बॉडीज की जितनी भी डिस्पेंसरीज, हॉस्पिटल्स और प्राइवेट जो हॉस्पिटल्स और डिस्पेंसरीज और लैब, सबका डेटा सर लेके हमने पोर्ट कर दिया है। सेंट्रल गवर्नमेंट की फैसिलिटीज का डेटा शायद अभी पोर्ट अभी ऑलरेडी प्रोसेस चल रहा है सर। हमने इनफैक्ट एक पब्लिक नोटिस भी दे दिया था कि अगर कोई बच गया हो तो वो भी आके इसमें जो है डेटा हमें दे और डेटा अपलोड हम कर पाए। तो वो काम भी हमने कर दिया है सर। फिर हमें कहा गया था सर कि वैक्सीनेटर्स जो है एडिशनल आप आइडेंटिफाई करें। तो हमारे पास जो रेगुलर इम्यूनाइजेशन के अलावा भी हमने कुछ वैक्सीनेटर्स का डेटा वो भी अपलोड उसमें कोविन सॉफ्टवेयर में कर दिया है। चौथा हमें कहा गया था सर कि जो कोविन सॉफ्टवेयर के बारे में आप ट्रेनिंग करवाएं सर, वो पूरी ट्रेनिंग प्रोसेस अभी एक राउंड हमने किया है और एडिशनल ट्रेनिंग्स हम कोविन सॉफ्टवेयर के ऊपर सर हम अपने स्टाफ की और डिस्ट्रिक्ट लेवल पे, डीएम्स लेवल पे भी वो ट्रेनिंग्स करवाई जा रही हैं और एक लेवल हो चुका है, दोबारा करवाई जा रही है। आज सर, आज 2 बजे एक और रिफ्रेशर ट्रेनिंग भी गवर्नमेंट ऑफ इंडिया की तरफ से करवाई जा रही है सर। फिर हमें कहा गया था सर कि AFI मैनेजमेंट के लिए आपको कुछ एक्टिविटीज करनी है, जैसे कि सर उसको एक्सपैंड करना है स्टेट लेवल पे और डिस्ट्रिक्ट लेवल पे। AFI कमेटीज को हमने कर लिया है, उनकी मीटिंग्स करवा दी है सर। जो उसके अंदर आइटम्स की रिक्वायरमेंट थी, किट्स की सर, वो सारी पूरी की जा रही है सर। फिर हमें कहा गया था सर कोल्ड चेन की ऑगमेंटेशन करनी है सर। तो उसकी असेसमेंट करके कि हमारी एग्जिस्टिंग कोल्ड चेन में वैक्सीन स्टोरेज की क्या कैपेसिटी है और एडिशनल स्टोरेज कैपेसिटी हमने क्रिएट कर ली है सर। एक हमारे पास स्टेट में वैक्सीन स्टोरेज सेंटर था सर हमारा, सिविल लाइंस में ही। हमने अभी एक नया एडिशनल एक स्टेट वैक्सीन स्टोरेज सेंटर सर ईस्ट दिल्ली में से शारदा डिस्ट्रिक्ट में जो राजीव गांधी सुपर स्पेशलिटी हॉस्पिटल है उसके अंदर क्रिएट कर लिया सर। वो चालू हो गया है सर और उसके अंदर नया इक्विपमेंट आके हमारी वैक्सीन स्टोरेज कैपेसिटी ऑगमेंट हो गई है सर। तो ये सर सारे मुद्दों पे सर जो भी रिक्वायरमेंट्स थी, टाइमलाइंस की, ऑपरेशनल गाइडलाइंस के मुताबिक, हम उसी गाइडेंस के मुताबिक सर हम सारे कार्य करते हैं। अब बात आती है सर कल की जो ड्राई रन की, उसमें भी हमें जैसे बताया गया था कि एक गवर्नमेंट हॉस्पिटल हो, एक प्राइवेट फैसिलिटी हो और एक PHC है। तो हमने इसी तरीके से सर 3 अलग अलग डिस्ट्रिक्ट में, सेंट्रल डिस्ट्रिक्ट में सर हमारे तीनों DMs अपने मेडिकल टीम्स के साथ सर अवेलेबल है यहाँ पे, उनसे भी हम सुन लेंगे सर। तो सेंट्रल डिस्ट्रिक्ट में सर एक PHC है सर, अर्बन PHC दरियागंज में, वहां पे हम ड्राई रन करेंगे। शाहदरा डिस्ट्रिक्ट में सर GTB हॉस्पिटल आपने बताया सर, वहां करेंगे। और साउथ वेस्ट डिस्ट्रिक्ट में सर एक प्राइवेट हॉस्पिटल, वेंकटेश्वर हॉस्पिटल में करेंगे। तो ये दोनों के बारे में सर दिस इज डिटेल सर। इफ देयर इज एनी अदर इंफॉर्मेशन और एनी क्वेश्चन सर आई विल बी।
नहीं, आपने ब्रॉडली तो बता ही दिया है। ये जो डिस्ट्रिक्ट मजिस्ट्रेट्स और जो 3 जगह के जो हमारे मेडिकल ऑफिसर्स इंचार्ज जो आज खासकर इसमें मीटिंग में प्रेजेंट हैं, तो हम चाहते हैं कि उनसे भी थोड़ा सा जो साइट के ऊपर जो प्रिपरेशंस हैं, खासकर जहाँ वैक्सीनेशन मिलना है या जो 25 लोग जो है इस ड्राई रन में जो है उनको हमने तय किया है, उनके बारे में जो तैयारियां हैं, थोड़ा सा उसके बारे में अगर हमें बताएं। और ख़ासकर जो वैक्सीनेशन साइट्स और वैक्सीनेटर्स को जो आपस में उनकी जो रिस्पॉन्सिबिलिटीज़ क्या क्या हैं, क्योंकि वैक्सीनेटर्स में भी जो है सबके लिए अलग अलग रिस्पॉन्सिबिलिटी तय की गई है। अगर आप लोगों ने गाइडलाइन देखी होगी तो क्या उनको वो सारी चीज़ें पता है? तो एक बार जो ईस्ट दिल्ली से शुरू कर लेते हैं, जो GTB हॉस्पिटल का सेंटर है, वहाँ के जो इंचार्ज है और वो जो DM है वो हमारे को कुछ बताएं लोकल प्रिपरेशंस के बारे में।
गुड आफ्टरनून सर। सर कल के लिए ड्राई रन के लिए हमारे यहाँ जीटीबी हॉस्पिटल है, उसके अंदर हमने सेशन साइट तैयार किया है सर। एक जनरल ओवरव्यू पूरे डिस्ट्रिक्ट का देना चाहूंगा सर। हमारे पास वैक्सीनेशन के लिए 44 टोटल सेशन साइट है सर। उसमें से 31 सेशन साइट हमारे पूरी तरह से तैयार है, उसमें किसी भी तरह की कोई कमी नहीं है सर। 13 है, उसमें कुछ छोटी कमियां हैं सर, उसको हम लोग ठीक कर रहे हैं। उसमें बेसिकली सर 3 रूम चाहिए, कुछ में 2 रूम है, तो उसमें हम लोग टेंटेज के थ्रू बनाएंगे, क्योंकि एक वेटिंग एरिया का चाहिए सर, एक वैक्सीनेशन रूम चाहिए और एक ऑब्जर्वेशन एरिया के लिए चाहिए। तो वो भी हमारी तैयारी पूरी तरह से है सर। उसको हम लोग अगले जब भी स्टार्ट होगा सर, हम उसके लिए पूरी तरह से तैयार है। ट्रेनिंग का जहां तक सवाल है सर, जो जितने भी हैं हमारे पास सर टोटल डॉक्टर्स और जो सुपरवाइजर है सर 70 हैं, उनकी पूरी ट्रेनिंग हो रखी है सर। जो वैक्सीनेटर है 110 है, जो कि हमारे डायरेक्ट हैं, इनकी भी ट्रेनिंग हो रखी है सर। एडिशनल हमने प्राइवेट के लिए 63 का रखा हुआ है सर। ये मंडे का इसका ट्रेनिंग रखा हुआ है सर, ये भी पूरा हो जाएगा सर ऑलरेडी। उसके बाद सर सिविल डिफेंस के सर आज का ही रखा है सर। सिविल डिफेंस के 150 है हमारे स्टाफ, उनकी भी ट्रेनिंग हो गई है सर। और सीडीओ जो कि डीओ है, डाटा एंट्री ऑपरेटर 60 है सर, उनकी भी ट्रेनिंग हो रखी है सर। तो ओवरऑल तैयारी सर हमारे पूरे डिस्ट्रिक्ट के हिसाब से हमने कर दिया।
Well, that was the health minister there taking stock of the big vaccine rollout program which is currently in the works, and he interestingly said the year 2021 is going to be better than 2020. A very hopeful message there coming in from the health minister, and this comes at a day when the government appointed expert panel on vaccines is currently meeting to decide on the emergency use of COVID vaccine. My colleague Ayushman has been tracking these meetings, tracking all the updates coming in. Ayushman, it appears that on the first day of this year, there is going to be a decision made, perhaps today itself, about when this vaccine is going to be available.
Yes, Aarti. In fact, we are right now at the FDA house. This is the place where the meeting of CDSCO subject expert panel is currently going on, and we are being told that 3 applications which are there with them, which is of Serum Institute, which is India is very hopeful of, and the other one Bharat Biotech, and also Pfizer, which has also got the nod from the WHO. They are somewhere expecting for the emergency use authorization today, Aarti. At the same point of time, the Union Health Minister has also mentioned the fact that the subject expert committee is going through aggressively the data that has been submitted because it is the safety and efficacy data that has to be looked, and once the recommendation is made from the SEC, after that the matter will go to the DCGI, after which if the approval is from there, which in all likelihood will be there, the emergency licensing process begins, and then we can expect what we are seeing right now in United Kingdom in AstraZeneca's case, that the COVID vaccine rollout will be there. This is the first vaccine which we are banking upon, Aarti.
Well, this is the first vaccine that we are banking upon. Now, we'll bring you all the updates from that meeting. Ayushman, thanks so much for joining us. What does this mean for India? When can we expect the vaccine to be available? And how mammoth a task is this entire immunization program? Well, to discuss that and more, Dr. Rajesh Parikh, who's the Director of Medical Research of Jaslok Hospital and author of the book, The Coronavirus, as well as Dr. Deepak Natarajan, Senior Consultant, Interventional Cardiologist and Public Health, join us to discuss this. Gentlemen, thank you so much for joining us. I apologize for having to keep you waiting. We were just actually listening to what Dr. Harshvardhan had to say. I actually want to quote from something that Dr. Harshvardhan said. Dr. Natarajan, this is for you. He said the preparations are like general elections where even booth level preparations are made. This is a mammoth exercise, isn't it? How different and difficult is this vaccination program, the planning, the implementation in terms of its rollout going to be?
I'm quite happy with the words spoken by the health minister. He seemed very reassuring. We seem to be fairly well prepared as opposed to the Americans. There is an editorial published today by the New York Times, which is really criticizing the American reaction. Apparently, the Americans have about 13 million vaccine doses, but only 3 million have been used so far. And there is a lot of problem about personnel being trained well enough. However, in India, the minister seems quite well prepared. The personnel below him are also well prepared. And I think our vaccine program rollout will be much better, tempered with the knowledge that the vaccines which we will be using are more easily stored and more easily distributed, whether it is the AstraZeneca vaccine or the ICMR vaccine, which is being made by Bharat Biotech. You see, we have two vaccines. One is the DNA vector vaccine, and the other is the killed inactivated vaccines. Both can be stored in a regular fridge for months. So therefore, I expect that the vaccination program would not be a huge problem. And we have the personnel, we have the training. I have worked for the government for almost 20 years, and people there are very bright and also very hardworking. So this should not be a major problem.
Well, Dr. Natarajan, you did briefly touch upon this, and I want to drill down a little more on the challenges in terms of which vaccine is best suited for the Indian conditions. But before that, I want to go to Dr. Parikh as well, who was nodding along very vigorously while you were speaking about how mammoth and how difficult this program is going to be.
Well, I was actually nodding along when Dr. Natarajan was speaking about the lack of preparedness in the United States. And that was because, last evening I got a call from a colleague in the United States. He's a prominent physician himself, and he had been urgently called to receive the Pfizer vaccine. And actually what had happened in that city is that the vaccine had come in a truck which was refrigerated at minus 70 degrees centigrade. And just as they were about to give it to the hospital, they found that the hospital did not have the facilities for storing at that lower temperature. They discovered that at the last minute. So they urgently told everybody in the hospital, regardless of the priority list, to come and get vaccinated. So he called me to tell me that this vaccine has been outside of the range for about 11 hours. Should I take it? I have also been working on a book on vaccination currently. So I was aware that it could stay for that period of time outside of what is prescribed and still be fine. So I was nodding because they're not prepared. But on the other hand, when we look at ourselves, let us not forget the robust experience that we've had in eliminating smallpox, in eliminating polio. So, in a sense, we've had our dry runs long ago, and we have done very well indeed in vaccination programs. Our vaccination program is amongst the best in the world. We manufacture the highest number of vaccines in the world. And perhaps not too many people know that 1 out of every 2 children who gets vaccinated in the world gets an Indian vaccine.
That's true, Dr. Parikh. We sometimes are very harsh and critical of our systems, but this is a mass immunization program in a country like ours, has its own challenges, but we have a lot of experience in this department as well, as you were saying, and that is something that's going to come handy. Now, you as well touched upon temperature, which is a big challenge, I think, in terms of our vaccination program, our cold storage facilities, considering our temperature as well.
Oh, absolutely. I mean, minus 70 degrees is not an easy temperature to reach, leave alone to sustain. So these are going to be enormous challenges because, mind you, the cold chain has to be maintained from the point of manufacture almost till the point of administration. And on the way, if there are any lapses, then the vaccine is not effective. But on the other hand, we have vaccines available today and coming up in future where the temperature requirements are not that rigid and which can be done in our setting.
Dr. Natarajan, you want to weigh in on this?
I'll just dilate on what Dr. Parikh has just said. And we have to keep in mind that we are talking about 2 vaccines, right? These 2 vaccines don't need a minus 70 degrees centigrade
Exactly.
storage. These are the Bharat Biotech ICMR vaccine and the AstraZeneca vaccine. Both are stored in your regular fridge. So that should not be a problem. And as to which is the best vaccine, I won't go into that. But we have 2 vaccines, and I think Pfizer will be also presenting their data very soon. And they may or may not get authorization. However, I want your viewers to learn that we have a massive artificial insemination program going on in this country. And this means that about 1 crore artificial insemination take place in cows, in cattle. And the semen of the bull is has to be stored at a temperature not of -70. It has to be stored at a temperature of -195 degrees centigrade. And we manage that. We've been doing that for years. So in case, and I think that is stored in liquid nitrogen. So therefore, we have the expertise in the country also. So therefore, in case the Pfizer vaccine comes in, or rather the Moderna, which is slightly more stable, if the Moderna vaccine comes in this country, storage and distribution should not be a huge problem. But let us be practical. We have the Indian vaccine, the inactivated vaccine from Bharat Biotech in collaboration with the ICMR. This should be fine. This is kept in a fridge. It does not enter your nucleus of your cell, as opposed to the AstraZeneca vaccine, which is a vaccine where the gene is put inside a disabled adenovirus, which is your common cold virus. In fact, AstraZeneca used the chimpanzee adenovirus for its penetration. And then this codon, this gene penetrates into your nucleus and then commands or prompts your nucleus to manufacture the spikes. So between the two, we have a choice. The AstraZeneca vaccine is what could be called a genetic vaccine, a gene vaccine, and would still be considered experimental, whereas the totally developed indigenous Indian vaccine has been with us for years. And so therefore we know more about it. So that is the situation here.
Well, gentlemen, I do appreciate both of you being really optimistic about India's preparedness. I think that's a good way to start off this new year, with this optimism and, renewed vigor that this is something that we can certainly overcome. But Dr. Natarajan, there is a meeting currently underway in which the three ones that you were mentioning, Pfizer, Bharat Biotech as well, and Serum, are both making their cases to the government for an emergency authorization. Out of this, Serum is right ahead, first in line. It appears very likely that perhaps we will hear some good news very shortly about that. But what is the evaluation process like for something like this? What are the factors that are considered before giving emergency use authorization?
Well, that's a very, very good question. Look, these companies have to do trials. We have for anything, for any gadget which is used in medicine. We have a phase 1 trial where we take about, say, 70 to 100 to or 150 people, where we first test for the safety of the product, whether it's a pill, whether it's a stent, or whether it's a vaccine. We test for the safety. Once we find that the ingredient is safe, then we go on to the phase 2 trial. Here we test for the efficacy, whether the stuff works or whether it does not work. Now, we take more people here. We would have 200 to 300 people here, maybe 400 people, maybe 500 people. All right. Now, if the ingredient passes this phase 2 test or the phase 2 trial, then we go for the phase 3 trial, which is testing for both the safety and the efficacy of the product. And here we have thousands of people. So here, let us be specific. AstraZeneca has so far given data phase 3 trial, which has been published already in the Lancet a few weeks back. And this included about 12,000 people, more than 12,000 people in a randomized fashion. So we have the data. We have a peer-reviewed data which has been published in a major medical journal, albeit it is a British journal, a British vaccine, and a British journal. Yesterday, the New England Journal of Medicine has published the data from Moderna. Now, that also has included 30,000 people. So they did the phase 1 trial, which was published. They did the phase 2 trial, which got published. Now they have published the phase 3 trial. Here, the vaccine is very effective, as opposed to the AstraZeneca vaccine, which has an efficacy of about 60%. The Moderna vaccine has an efficacy of 94.1%. And most importantly, the Moderna vaccine, above the age of 65 years, has an efficacy of 86%. Below the age of 65, it has an efficacy of 96%. That is very important, because remember, please, your viewers must be told that the AstraZeneca vaccine has an efficacy of about 60%. And there has been no efficacy checked above the age of 55 years. Only 4% of the volunteers were above the age of 70 years. Now, the efficacy of the vaccine must be known above, above 50 or 55 years. That is very, very important. Now, what more should I add? So we have a phase 1 trial, we have a phase 2 trial, we have a phase 3 trial. Both these vaccines have published their data. Data from the ICMR vaccine has yet not been published in a peer-reviewed journal. We don't know. I think the phase 3 trials is going on. And so we will have, we would be making a premature decision on the Biotech vaccine. But also one must bear in mind that other countries, for instance, Argentina has approved yesterday of the AstraZeneca vaccine. So that is the second country in the world after England, which has approved the Oxford vaccine. And I think they have just relied upon the data which was presented to the UK regulating agencies. And that is what our people will be doing also regarding the AstraZeneca vaccine.
Right. Dr. Parikh, you want to come in on that?
Oh, absolutely. I think that was a very comprehensive coverage of the various phases that the trial goes through. And I just want to add a bit to make it totally comprehensive. One is on the efficacy part. And I'm sure Dr. Natarajan is aware of this in the Lancet paper that was published. And what had happened is that accidentally or perhaps otherwise, there are two opinions about it. But one thing is certain, that 3,000 volunteers in that study, in the first part, the vaccine is given as 2 shots, the first shot and the booster shot. In the first shot, about 3,000 volunteers got half the intended dose of what was to be given. And then that was corrected. And then in the next slot, everybody got the full dose. And to their surprise, and one might assume it was a surprise, they saw that the lot that got half the dose actually had more than 90% efficacy. So the half dose was better than the full dose. And then, some people in AstraZeneca said, well, that's the way we had actually planned it. So nobody's sure whether it was accidental or not. But as far as efficacy is concerned, I'd just like to cover that the AstraZeneca trial had, if you want to assume that was a flaw in it, which strangely and paradoxically seemed to show that the half dose actually worked better than the full dose. 2 other things I'd like to add to Dr. Natarajan's review of this. So he's covered safety comprehensively. We've talked about efficacy. There are 2 other issues we must talk about. That is legal indemnity and, of course, effectiveness. So mind you, efficacy is something that is established in the phases of trial that Dr. Natarajan talked about, very rigidly controlled laboratory or clinical settings. Effectiveness, on the other hand, is what happens in the real world. And quite often in the past, vaccines which have been efficacious have not necessarily been effective. And the other way around, you could have an efficacy which is not very high, but it could actually be very effective in conditions. And the last thing I might touch on, because I assume that's what would be discussed today, is the indemnity. Pfizer BioNTech has been launched in the UK with a strange and peculiar indemnity clause, whereby all legal responsibility vests with the UK government. That's what they've been trying to do with the Indian government for the past 2 weeks. Our government has resisted, and that makes sense too, because you can't have the profits going to one entity and all the risks on the government of India. On the other hand, it may be said in Pfizer's favor that they are possibly partially correct, because as we have seen, if there are any errors in distribution, cold chain maintenance, then that makes the vaccine inefficacious. So somewhere between lies the truth, where the indemnity has to be distributed. And just because we are in an emergency situation, it cannot be completely left to the Indian government to pick up all the legal responsibility. So that's one more point which I'm sure is being negotiated today.
Dr. Parikh, since you have been mentioning volunteers a lot in what you're saying, and gentlemen, I really do appreciate both of you taking time and speaking to us. This is a very important conversation and very informative for all our viewers. But we had a bit of a problem actually when it comes to the Bharat Biotech trials, because just a few days ago, last week, in fact, on Mirror Now, it reported about how in all the major cities, Delhi, Mumbai and Bangalore, we've had a shortage of volunteers. There aren't enough volunteers coming forward for phase 3 trials. And that's due to a lot of reasons from what we've gathered from experts, when some of it is fear, some of it people feel that, oh, vaccine is already just around the corner, so we don't need to volunteer for this.
Look, can I come?
Right. So,
Right. No,
go ahead.
go, Dr. Parikh, please carry on.
I'm sure I'm about to say what you're going to say, so it really doesn't matter. You could complete it.
No, Dr. Parikh, and then I'll come to Dr. Natarajan as well.
All right. So in this question of volunteers, you see what happens is, you have the double-blind controlled trial, which is the gold standard and which is what the Bharat Covaxin will be studied in. And in that, half the volunteers get a placebo. They don't get the vaccine at all. So there is understandable concern that, I might have a 50% chance of not getting the vaccine. On the other hand, it's going to be a while before the actual vaccine is available. And if people go through the trial, they will know at the end of the trial whether they got the dummy vaccine or the real vaccine. And should they get the dummy vaccine, of course, they can take the real vaccine with no problems at all. So this is an understandable concern, but it's something that can easily be allayed.
Yes, Dr. Natarajan, you wanted to come in?
Yes, he's raised a very good pragmatic point. I could add by saying, which I've mentioned repeatedly, that the disease is somehow declining in India. You see, unlike the West, unlike the United Kingdom, unlike the US, the reality is that now we are having on an average only 20,000 cases in a day. Mortality is less than 300 in a nation which has a population of 140 crores. The Delhi news is even brighter. We have just about 25 to 30 deaths on a single day. The number of cases have also declined very rapidly. Now, when you have fewer cases, you get fewer volunteers. That is a practical problem. But, however, people should not hesitate from volunteering. If they get a chance, they should volunteer into this program. But these things are happening. The fact is that the disease somehow is declining despite the fact that this is winter. In winter, the virus becomes more active and it becomes less active in summer. So despite the fact that the temperature is going down, we are facing a cold wave in the entire north. The number of cases are not increasing, and this is a practical problem. But of course, now we have the vaccine. If the regulating authorities approve of the vaccine, I think we begin the rollout.
Dr. Natarajan, on a lighter note, some might consider it a miracle that the numbers are falling to such an extent, because we've seen people become so lax. People don't wear a mask. They're gathering. You can see some of the celebrations from New Year's Eve parties. It's absolute insanity if you think about it, because we're still in the middle of a pandemic. So I would say sometimes it's probably a miracle that our numbers are falling and we're bucking the trend in the West.
No, it's not a miracle. Nothing. There's no miracle. There are no miracles in the world. There's a biological reason, and probably the biggest reason is that most of us have already been infected. We have the antibodies, we have the T cells. So therefore, whether people accept it or not, we are very close or on the brink of some form of herd immunity. So therefore, that is the reason. But what you're saying is absolutely correct. The public must understand that none of these trials have shown a reduction in asymptomatic infection, which means that even if you are vaccinated, you could still carry the virus inside you and you could still transmit the virus.
True.
So therefore, even after you have been vaccinated, you will have to continue maintaining distance. You will have to wear a mask in a crowded place, and you will have to continue with washing your hands. And I think there is a law, some kind of a ruling has been passed already in England that even after you have been vaccinated, right? Even after you have been vaccinated, and if you are found to be a contact of somebody who has become positive, you still have to quarantine. So these things will have to be kept in mind.
Yeah.
Yes, go ahead, Dr. Parikh. Please go ahead.
Yeah, Aarti, what you said just reminded me of a very interesting exchange between Julius Caesar and the soothsayer that Shakespeare wrote into the play, the Julius Caesar play. And, Julius Caesar has been warned that the Ides of March are going to be dangerous for him. That's, in fact, the date on which in 44 BC he got assassinated. And the soothsayer has warned him. And Julius Caesar is on his way to the Senate, where he will be subsequently assassinated. And he, sees the soothsayer in the crowd. And he tells him, the Ides of March have come. And the soothsayer nods at him and says, yes, but they have not yet gone. And so to people who are, think that everything is on the decline, there are mutant strains on the virus. Some of these have been discussed amply in the media. And we should also keep in mind that 100 years ago, when the influenza pandemic was there, just when it looked like the first wave had settled down, there came a second wave, which was far more ferocious than the first. And after that, there was a third wave as well. So, let's not relax a bit too easily. It's true that the first wave is diminishing, but that doesn't in any way assure us that there won't be a second wave. And secondly, I'd just like to add that even after the second booster shot of the vaccine is taken, it's going to be another 10 days to 2 weeks before the immunity really kicks in. And thereafter, too, people will have to maintain all the precautions they're maintaining, because we're very early in the vaccine game. And as of now, there is no certainty as to how long this immunity is going to last.
But I think that's a key question. There is no certainty, and that also, there are a lot of questions that people have, and I just let me summarize at least 2 or 3 questions, which I'm sure a lot of our viewers will have, and I can come to both of you. We can go around the table for that. First of all, what happens if today, for instance, the vaccine gets a go-ahead? How long before the actual immunization program begins? First, obviously, of healthcare workers, priority groups, and then the rest of the country. And secondly, what happens once you're vaccinated? It's a 2-dose program. Let's say you get both your doses. How likely are you to contract the vaccine? What if you get in touch with somebody who has COVID? What is the protocol, or what should we expect after the vaccination? Dr. Parikh, if I can start with you.
Oh, yes. So I think this is a very, very relevant and practical question. So once somebody gets the first dose, that person should keep in mind that the second dose, depending on the vaccine, the Moderna vaccine, for example, is after 3 weeks, and the Pfizer BioNTech vaccine is after 4 weeks. So depending on that interval, until the second dose comes in, they're still as likely to get infected, and they have to follow all precautions. Once the second dose is given, for another 2 weeks to be safe, they continue to be very, very careful. But at that point, the concern is that now they may feel that they've got immunity. So they need to remember, first of all, none of these is 100% efficacious. And again, that subtle distinction between efficacy and effectiveness, we will only know the effectiveness with time. So in that sense, even the people who get the vaccine are kind of volunteers in a long study, the phase 4 and what happens beyond that. But because of the uncertainty that we spoke of, people will have to follow all these precautions for a long time. And finally, even if somebody is immune to the virus by virtue of the vaccine, they still can transmit the virus with some of the vaccines. Some of the vaccines are a little more effective in blocking transmission as well. So I think the broad lesson is you have to carry on with these precautions through the greater part of this year.
Natarajan?
Look, to give you a specific answer, it has already been published that immunity kicks in after 10 days or 12 days of the messenger RNA vaccines. So therefore, you have partial immunity, but complete immunity comes in after the booster injection. Now, that will apply also for the AstraZeneca vaccine and also for the killed vaccine. Complete and total immunity will develop after a fortnight of the second dose. Now, I am very, I feel very odd because about comparing the current pandemic with the 1918 pandemic, I think those are completely 2 different situations, because in 1918, our ancestors did not have the luxury of a knowledge of what is a RNA, what is a messenger RNA, what is a DNA. They did not even have antibiotics. They did not have any electron microscope. They had no monoclonal antibodies. They did not have remdesivir. They had nothing. They still managed whatever to handle that situation then. So a comparison with 1918 to now is rather far-fetched. And one more thing I must add here, and that is a lot of noise has been made about this new strain or new mutant. Your viewers must understand that technically this is not a new strain. A strain means that the virus has altered to the extent that it becomes a new biological entity. It changes the pathogenesis in the person in which that infection takes place. Also, viruses like us and like all other organisms in the universe, in our solar system, whether it's a fly, whether it's a cat, whether it's a plant, whether it's a lion, whether it's a tiger, our cells keep dividing. And in the process of division, they make little mistakes. And these are changes in the base proteins. The COVID-19 has a gene of, not a gene, but the chromosome is just about 30,000 bases. Now, when it divides, there may be few changes in the bases. There could be a deletion, there could be a substitution. Now, when this is happening, these are called changes, right? These are not technically mutations. And there have been already 13,000 changes in this virus over the last 10 months. This has already been reported in Nature Communication. And all virologists are aware of this. Now, despite the 13,000 changes or oblique mutations, the virus as yet has not become either more virulent or has become more potent. And this is confirmed by the fact that even now, this so-called mutation or so-called new strain, which has been first spotted in England, their own public health England, which is their official organization, has summarized in their website, which they published every week, that there is no evidence that there is a significant increase in mortality or admissions in hospitals or reinfection with their changed or the new variant, which they now call a variant of concern. So, right, one should never lower down the guards. One should never be less cautious. However, the reality is that somehow we are a different ethnic or a rather different group of population. We have strangely a stronger immune system. This is not a miracle. We just made differently. Probably we are exposed to more infections in our childhood, and that is what has made us more immune. Or probably we've had previous corona infections. Corona, by that I mean the common cold coronaviruses. And because of that, and also because maybe a lot of us have had a BCG vaccination, which is a general booster. So because of all these factors, because we are already immune, and also because we are a younger population. You see, I understand that just about 6 or 7% of people are above the age of 65 years. 50% of the people are below the age of 18 years. So therefore, because of a younger population, because of better immunity, we are less vulnerable to this virus as opposed to the Westerners.
True.
And therefore, keeping everything in mind, we are on the brink of a vaccination program. If they authorize these vaccines today, then the rollout can begin this week itself.
If I may, Aarti.
Yes, but very briefly, Dr. Parikh, unfortunately I'm running out of time, but I'll allow you to finish.
How much time do I have?
I don't want to put a timer on you, but please go ahead.
Okay, let's wrap it up in a minute. The question of the relevance or lack thereof of the 100-year-old pandemic has already been answered in 2019. We have seen that South Korea, which was the poster child of handling the pandemic, has in fact currently a second wave. Germany, which did a phenomenal job in the beginning, has a second wave. Sweden, which took a completely different approach, which some thought might be a model to follow, has a horrible second wave. These are countries which are shutting down during Christmas. So what happened 100 years ago, of course, the analogy is not complete. It's a different situation, but some things don't change. We are already seeing the second wave in other countries. And finally, as somebody said, those who do not learn the lessons of history are condemned to repeat it. I sincerely hope in this new year that we are not condemned to repeat the lessons either of 100 years ago or even 2 months ago.
Well, Dr. Parikh and Dr. Natarajan, very, very informative discussion. I truly appreciate both of you taking time out. I'm sure our viewers have been, enlightened to a ton of information from this discussion. I thank you both for speaking to Mirror Now. And hopefully this new year is not just going to bring in a new vaccine, but also we maintain our caution. We don't let our guard down. We continue wearing masks, maintain social distancing as much as possible. Gentlemen, thank you so much for joining us in this discussion. We're going to slip into a short break, but plenty more on the other side, so stay tuned.